Is getting 10,000 steps a day really optimal for us? As Dr. Ayman Lee explains, that concept was invented by a pedometer company as a marketing scheme. But what does the science say? And just how much physical activity should we be doing? How does the amount we do affect disease risk? Also, do we really know what are the best types of physical activity for longevity?
Just warming up.
A group of us had organized a longevity conference for TEDx. And one of the speakers we most wanted was Dr. Ayman Lee because she's so well known in her field for her work on longevity and exercise. After she gave her speech at the conference, we interviewed her.
Oh, I love it too!
She's a colleague of Professor Daniel Lieberman, who we also recently interviewed on the topic of exercise. Dr. Lee has been a professor of medicine at Harvard Medical School and a professor of epidemiology at Harvard School of Public Health for over 30 years. She has a medical degree from Singapore and a master's of public health and a PhD in epidemiology from Harvard. Dr. Lee has published over 550 scientific articles on physical activity and its link to health and longevity. She's also served on national and international panels for developing physical activity guidelines. She's one of two principal investigators on the Women's Health Study, which studied the physical activity of over 18,000 participants using accelerometers. One of her research articles showed that the harmful effects of physical inactivity may be as major as those caused by smoking, and that article has been cited over 11,000 times. We were also able to ask Dr. Lee about how exercise epidemiologists ensure that the results are valid. Without further ado, here's the interview.
I do work on my physical activity levels because obviously I do physical activity research. If I am not physically active, who's going to believe what I do?
So you're from Malaysia and you got a medical degree from Singapore before you transitioned into epidemiology. And I heard from one of your talks online that you sometimes still think about being a practicing doctor, but you'd rather be one in the Malaysian or Singaporean healthcare system rather than the US healthcare system. And I'd love to hear you talk more about why.
So that's correct. I was trained as a doctor and I practiced in Singapore for a while before coming here. Healthcare has changed a lot now. I find that, doctors spend a lot of their time doing paperwork rather than taking care of patients. So perhaps when I say I prefer to be a doctor in the Singapore system, I'm probably confusing with the time period, and maybe if I went back now, it's probably just like the US, that there is more emphasis now on efficiency, and unfortunately, I think the bottom line, rather than thinking of the old-fashioned doctor who came to your house, who looked after everybody in the family. I love what I do now, so it's giving up clinical medicine, but for something that I love.
Can you describe what your day-to-day is like, what kind of work you do?
I'm an epidemiologist and I do research in physical activity and health. A lot of my work from day-to-day basis is kind of boring because when you do a study, you have to make sure that the study is well run, protocols are followed, participants respond to the questionnaires that you send, participants wear the devices the way they should, collect the data. So that part of it is painstaking and tedious, and you have to do it slowly, carefully. What I love is once the data come in, to see what the data tell you about the research questions that you want. And I'm particularly interested in physical activity for the general public. I know that lots of people in the physical activity field have a sports background. They were trained as a gymnast, a ballet dancer, NCCA college runner. And I think for much of the population, most of whom are not physically active, these are levels of physical activity that most people can't relate to. So as I said, I grew up in Malaysia. Malaysia is super hot and humid. People here complain about Florida being muggy. Come to Malaysia. You sweat waiting to cross the street. I came from a background where I'm very privileged to be here now. My grandmother never went to school. She couldn't read and write. If she had to sign her name, she drew an X next to her name. So of course the emphasis in my family was like, you go to school, forget about playing around outside. You study so that you get a degree and get a good job. So when I was in Malaysia, Singapore, I hardly ever exercised. And by luck, I suppose, I met Ralph Paffenbarger, who's considered the father of physical activity epidemiology. And he was genetically very gifted. He could run very well in marathon. He did ultra marathons. He'd bring me to these conferences. And his colleagues will say, oh, what was the last race that you did? And he'd say whatever. And then he'd say what his time was, and they'd look at me and they'll say, "Oh, and this is your student? What does she do?" And I'd say, "Nothing." And it got so embarrassing. So I started exercising. So I run now, I walk, I bike, and I think I do physical activity at a level that a public person, a regular person on the street will understand. So I always say, if I can do it, you can do it too.
That's fabulous. And you've done some really landmark studies in your field. For example, you're co-director of the Women's Health Study. Can you talk about that?
So the Women's Health Study is a large nationwide study. It started in the 1990s, and it actually started as a trial testing aspirin and vitamin E for preventing heart disease and cancer in women. And that's, of course, an important question. But my research interest is in physical activity. So I wanted to study physical activity in these women because they are older women, and older women are one of the least active segments of society. So we managed to put devices on these women to look at the levels of physical activity and their health after that. So in particular, I was interested in, people ask the question, how much do you need? But I think most people want to know the answer to how little can I do and get away with it. And so this is what I was interested in, using data from the Women's Health Study. Now, we talk about physical activity and exercise, and we know how important that is for health. But I think maybe if you stop to really think about it, you can see how important it is. So about a decade ago, a group of us researchers looked at this question. We compared it to smoking. So if you could get everybody in the world to stop smoking, you would avoid about 5 million deaths each year. Now, if you could get everyone in the world who didn't meet recommendations for physical activity to be physically active to the level that's recommended, you would also avoid about 5 million deaths a year. So most people, when they think smoking, of course, it's terribly bad. Physical activity, well, I need to do it, it'll be nice. But they don't give it the same urgency as smoking. If you look at it from a public health perspective, the number of people that you can save if you get them to be physically active is the same as the number of people you could save if you got them to stop smoking. And this really underscores the importance of physical activity for your health.
That's really powerful. And is that smoking number of deaths versus physical inactivity number of deaths, is that coming from the Women's Health Study or your work in general?
So this was a project that we did about more than 10 years ago at this point. It was a worldwide project. It involves investigators throughout the world, and it was looking at data sets throughout the world to try to estimate the number of deaths attributable to physical inactivity, and to put it in a way that people will understand, that governments, policy makers will understand. Because when we try to communicate our message, if you hone it to a one-line message that underscores its importance, and you say smoking kills as many people in the world each year as does physical inactivity, I think that's something that policymakers can understand. It's sort of like a bullet point that you can remember.
Wow, that's really powerful. What are some of the other really surprising findings from your research?
So when I started in the field, the philosophy was sort of no pain, no gain. You needed to exercise vigorously. You needed to do your physical activity in a continuous bout before you got health benefits. And knowing this is sort of interesting because you have to understand how research findings occur, how investigators refine them. Early on, a lot of people on the expert panels that looked at exercise and health, they were primarily exercise physiologists, and they were interested in improving fitness levels. And the participants that they got from this for their studies tended to be captive audiences. They're graduate students. So the graduate students at that time were mainly young men. Young men were already fit. How do you get them fitter? They need to exercise vigorously to get them even fitter. So the early data that we based our guidelines on, the no pain, no gain guidelines, were primarily based on these sorts of data. Then epidemiologic studies on physical activity and health conducted in the general population started coming out. And so this is when we had the you could be physically active at a moderate intensity level. Walking is just as good. And then when devices started coming out, we see that you don't need to do your physical activity in a whole bout. You can do it in short bouts and add them up. It is a total that's important. When I was younger, I suppose maybe because I was also more physically capable, I sort of strongly believed in the no pain, no gain. And as data started coming in, I suppose what surprised me is that there's almost like no bottom line. So any little thing you can do is good. And I find this is such a powerful message because now we also have personalized medicine. It's not like one size fits all. So for each individual, have your own goal. You know what you're like. If you want to be healthy, don't try to be like the Kenyan marathon runner. If you're someone who's a couch potato, you know that you need to start slow and increase at a low point. So add anything you can. In our research, we found that adding any number of steps to your daily routine, say just 2,000 steps, can improve your health. Now, 2,000 steps for most people is roughly equivalent to a mile. And you might think, walking a mile, that may be a lot for someone. But remember, when you wear your devices, you're measuring every step. You're not measuring just the steps that you take for exercise. You're measuring every step that you take. So if you go to the kitchen to wash your mug, you're measuring those steps. You go to the bathroom, you're measuring those steps. The 2,000 steps can add up really quickly.
Well, that's really encouraging that just any amount of steps is really helpful to our health. You also have this really cool book that you published. Can you tell us about it?
Epidemiology is actually a discipline. We think of it as related to health, to medicine. But actually, epidemiology is a way of thinking of data. We have experiments that we can do where the data can be more solid. But a lot of times we have to rely on data that we collect, say maybe from electronic health records, from registries, or from studies where people fill in questionnaires, and obviously people with good physical activity habits also may be more healthy in other ways. They smoke less, they eat better. So epidemiology is a way of thinking about data, which I really like. It's like trying to find out the truth. How do you find out the truth? You exclude alternative explanations. Obviously, things like chance, there's a statistical thing. But there's also biases that you have to think about. Like we said, people who are physically active also are active in other ways. So how do you tease apart the truth? And so this is a textbook looking at epidemiologic methods specifically as applied to studies of physical activity and health.
So what are some unique considerations when you specifically apply it to physical activity? And I'm particularly interested because currently it seems like the trend online is to attack epidemiology and say, oh, you can't use causal inference, you can't use questionnaires, they're all inaccurate. So I'd love to hear how you find truth in the data.
So one of the big things actually is totality of evidence. I think we live in a fast-moving world and everybody's very interested in what the latest study says. And the latest study gets, shouted out. And it's not the latest study that's important. Of course, we can try to tease out the biases in each and every study. But to me, all these studies are like a jigsaw puzzle. One piece doesn't tell you everything. You need to have all the pieces before you see the picture. So I never get too excited by the findings from one study, unless it's the largest, most expensive, best, most beautifully designed experiment. Most of the time, studies aren't like that. You have to look at the pieces of data. So it's not just epidemiologic studies. Is it supported by biological evidence? Is it supported by basic science? It's the totality of evidence that gives you the whole picture.
The women's health study, I believe, was 18,000 participants. Are you currently working on any large-scale studies?
We are looking at the women's health study to look at many different endpoints, not just heart disease and cancer, which are the major causes of death throughout the world, but things like physical function, cognitive function, frailty, especially as they grow older. Now, there are many data sets throughout the world now that collect physical activity information using devices. So I'm working with collaborators throughout the world also to pool our data because we get more statistical power when we have larger data sets. One of the interesting things is that even though I believe in the devices, they measure our activity so well, there are a couple of things that they can't do. First of all, they don't measure muscle strengthening exercises very well. And we know that muscle strengthening exercises is important not just for function as people grow older, but increasingly we're seeing that it is also predictive of chronic diseases. The second thing is the devices at the moment don't give you a good view of the context that you do it in. So am I doing it as part of occupation and am I doing it during leisure for transportation? There's some data recently that suggests that occupational physical activity isn't as protective for health as leisure time physical activity, particularly in men. So we're not clear what that is. And one of the hypotheses I have is because the activity when you're doing the occupation, much of it is lifting and carrying, not the aerobic kinds of physical activity. And also, although investigators have tried to tease out sort of like the stress related to it, you can imagine that people who do a lot of physical activity on their job are also people who probably don't control their work environment a lot, and this might contribute to that. So even after statistically trying to adjust for that, we still see studies where physical activity in your work is not necessarily protective against a chronic disease. So going back to what this means with wearables at the moment don't tell you the context of it. Wearable data are great, but I think we still need additional data from perhaps asking people questionnaires. And I'm excited to see developers of wearables perhaps be able to gather more information through the wearables, not just the activity itself, but maybe things like light. Of course, we know sleep, but the context in which it occurs. And I would like to see if muscle strengthening exercises can be captured more precisely.
That would be really exciting. There are some studies out there which have compared different types of sports and which ones seem to confer the most longevity benefits. And those studies seem to suggest sports like tennis and badminton will lead to the greatest increases in life expectancy. Have you seen these studies, and what do you think about them?
Yeah, so the studies where I think the data are the best are the ones that actually pool the energy expenditure from all the different sports. And why is that so? That's because any study, large as it is, the number of people who play these specific sports, they're relatively small. The biggest group would be the walkers, because most people walk. All these other sports have smaller numbers of people, and by chance alone, you could get a significant finding. Having said that, the other thing that I would think about also is, we talked about epidemiologic principles. So the people who play tennis are people who play badminton. It could be the sport itself, or it could be that these sports are ones that you don't do alone. They tend to occur in a social setting. So is it the sport itself or the social connection that's helped them? Also, these are sports that you can play well into your older ages. You know, if you play basketball, for example, most people will probably stop basketball before they're older. But tennis, doubles tennis, you can actually play till you're older. So is it also because this is a sport that you can continue to your old age? I personally would not say that I strongly believe that there's these sports that lead to longer life, but I would say it's worth further investigation. If you like those sports, play them. It could be the social aspect of the sport, and it could be the longevity of your being able to participate in these activities.
Oh, interesting. Thank you for the detailed breakdown.
That's why epidemiology, guys. It's true that epidemiologic studies are subject to potential errors, but one of the important things we have to remember is if people don't remember things well, any associations that you see will tend to be diluted. So if you do see an association, the true association is probably stronger than what you've seen, which is why if you see an association, and this is not due to the other biases that you've already cleared out, the association is likely to be stronger than what you've seen. So a good example is physical activity. So physical activity in the past, before we had devices, people reported on their physical activity. Now, if you report on your physical activity, you may remember if you go for a run 3 days a week, but you might remember less well, sort of like the casual walking that you do or the walking for transportation. These studies of physical activity, which ask people about what they did before the health outcomes, the health outcomes cannot bias your recall because the health outcomes have not occurred. So you're remembering your activity, but you're remembering your activity probably equally badly whether you're someone who's active or you're not active. Now that we have devices and we can use the devices to measure people's physical activity, we see that the strength of the association between physical activity and health is far larger than what we had with questionnaires. So for example, with the questionnaires, we used to see that the risk of dying during follow-up among people who reported physical activity at a level commensurate with following guidelines would be on the order of about 20 to 30% reduction in mortality risk. With the devices, we are seeing reductions of the order of 50 to 60% in magnitude. So more accurate measuring gives you a stronger association. If you see an association with less accurate measuring, it probably means that the truth is stronger than what you see.
And it's amazing how much that percentage jumped just when you started measuring more accurately.
Yeah, that's why I say epidemiology is great, because it's a way of thinking. So when you look at like poor performing schools, for example, why are the schools performing poorly? And then you look at all these factors, is it a real association or not? You're using epidemiologic principles to look at the truth of the association. So it's not just for health, it's for everything. It's for law, it's for transportation. It's just a way of thinking, of logical thinking.
Yeah, so for exercise, it's easier to accurately measure because you can put on a pedometer. But food, people seem to still have to rely on their recall when filling out those food frequency questionnaires. So how can that be accurate?
It's true that food frequency questionnaires are not accurate in the sense that they don't measure exactly what a person eats. If you measure that food, watch them. But many of the diet studies, the data on food are collected again before the disease outcome has occurred. So the fact of your disease outcome cannot influence your recall. You are thinking about the foods that you ate inaccurately, but inaccurately across the spectrum. So if you see any associations, the associations that you see are probably weak compared to what truth is. And again, we don't rely on one single study. You have to look at the totality of evidence, the biochemistry of it, the biological processes by which you believe the food influences the health outcome. And if everything makes a coherent picture, it's more likely true than not. You will never get a gold standard study. So the gold standard study will be a randomized controlled trial. You take a group of people, you randomly assign them to different food regimens or different diets. You can do that probably for short periods of time because an experiment gives you good results only when people comply with what it is that you've assigned them to over the period that you've assigned them to. If you do an experiment and you assign people to these different groups, let's say for simplicity, 2 groups, you eat this food, you don't eat this food. But over a longer period of time, this group says, I don't like it, and half of them stop taking it. This group says, oh, I read in the news that this food is good. Half of them start taking them. Your 2 groups end up being exactly the same as each other, and your experiment is useless. So in that sense, observational studies are still important. They collect data on large numbers of people in the real world setting and for a reasonable amount of money that you can do the study. It's not the result of a single study. You have to look at data from all studies and try to form a coherent picture and make sense of the data that you get. It's just not useful demonizing one arm of study and not others. You just have to look at the totality of evidence.
I've heard you talk before about the efficacy of drugs versus exercise. Can you expand on that?
Many people say that exercise is medicine. I have a colleague who said exercise is not medicine. Exercise is a whole pharmacy. Which drug do you know that has so many effects compared to physical activity? And you could say, okay, how good is physical activity? Well, there have been studies that have statistically compared the effect of, say, physical activity, for example, compared to blood pressure drugs. And the effect of physical activity is equivalent to taking an antihypertensive, at least for people who are in the mild to moderate hypertension range. So physical activity is a really potent way of helping us to improve our health. And you'll notice that I don't say exercise, I say physical activity. I think because we've sort of evolved into our thinking. We talked earlier about no pain, no gain, and that's the exercise paradigm. Exercise is actually a subset of physical activity. Exercise is what we mean when people do something that's structured, that is repetitive, with a goal of improving your performance. So you go out for a run, you go play tennis. The term physical activity is more all-encompassing. Physical activity is any bodily movement that expends energy expenditure. So if you play with your grandchildren, you're physically active. If you ballroom dance, you're physically active. If you garden, you're physically active, which is why I like that term. It is something that everybody can do. Pick what you like and do it. I won't ask you to swim if you don't like to swim. You might try it for a week and then you're not going to stick with it. But if you like to garden, go ahead, go garden. If you like to play pickleball, hey, go for it. Whatever you like, just move and enjoy that movement.
That's a wonderful phrase. And do you have any advice or insights on how we can get more people to move? I think that's the $1,000,000 question.
Yeah, so I think it's starting small and adding to it. So what do I mean by starting small? So for example, your laundry's in the basement. What do? You throw your clothes down the stairs. Then at the end of the week, you go gather it and go do your laundry. Why not walk down the stairs and put your clothes there each day when you want to do your laundry? That's like a habit that you can pick up. Most people, when you go to the grocery store, you'll circle around and look for the closest spot. Why not park in the first spot that you see and then walk the rest of the way? Or things like if you take public transportation, get off at the station that's one before the one that you usually get off and walk to it. Do these little things. They're not a lot. It's not a huge effort. And once it becomes a habit, you will do it. We are on the 3rd floor now. A ton of people in my office take the elevator. I don't know why they take the elevator.
But you're in the school of public health, right?
It's probably habit. And then when the elevator gets broken, everybody's stuck. I can't remember the last time I took the elevator here. It's just habit. I just don't think about it. Plus, you have to wait for it.
I love how you practice what you preach.
Yeah, I have to. Nobody's going to listen to me otherwise.
So you currently got teaching some really brilliant Harvard students, and you're also co-director of this amazing women's health study. What are your other current projects, and what are your future goals?
One of the projects I'm really interested in now is, we talked about muscle strengthening exercises. So our physical activity guidelines tell us to do aerobic physical activity as well as muscle strengthening exercises. Most of the data in the field relate to aerobic physical activity. We know relatively little about muscle strengthening exercises. So in the past, we knew it's important, we know it's important for older people to maintain their function, but increasingly we're beginning to see that it's important for reduction of chronic diseases as well. Our guidelines tell us to do muscle strengthening exercises that involve all major muscle groups on 2 days of the week. Now, if you talk to the regular person on the street, they'll probably say, how long do you need it for? We actually don't know. I'm collaborating with a colleague, Dr. Lee from University of Pittsburgh, and we're starting an experiment where we get groups of people to do muscle strengthening exercises on 2 days a week, but it's 15 minutes, 15 minutes, 30 minutes, 30 minutes, 1 hour, 1 hour. And we're going to see what their cardiometabolic risk profile is after this period that we get them to do the muscle strengthening exercises. I personally am rooting for the 15-minute group because that's a level I think that a lot of people would agree to work on.
You mean 15 minutes and then break?
15 minutes, because remember our guidelines tell us to do muscle strengthening exercises on 2 days of the week. So they come in for 2 days, and what do? They do muscle strengthening exercises 15 minutes as well as other aerobic activity. The second day they come in, 15 minutes also. Another group comes in and does it for 30 minutes and aerobic activity, 30 minutes and aerobic activity. The third group comes in, does it for an hour, aerobic activity, an hour aerobic activity. So imagine if you're the 1 hour group, that's a ton of time in the gym. But if you're a 15-minute group, woohoo, 15 minutes and I'm out. So I'm rooting for this group to succeed.
I'm rooting for that group too. And is there anything else about epidemiology that you want to debunk?
Epidemiology is not going to tell you the truth about everything, but epidemiology is a very powerful tool that can help you discern the truth.
You advise us to look at the totality of evidence, but nowadays we're always bombarded with the latest study, the latest headline, chocolate's good for you, it's bad for you. How do you make sense of this all and actually focus on the total picture?
That's a really hard question. I probably should say, I don't really know. I think people should be discerning, meaning that whatever you hear, take it with a grain of salt and see whether you can corroborate that with other sources. And when I say other sources, I say trusted sources. And what do I mean by trusted sources? So trusted sources would be things that generally the public agrees is not extreme or weird, for lack of a better word. And to be able to weigh everything that you've read and to have your own way of educating yourself and thinking, is this too good to be true? And if it's too good to be true, it probably is too good to be true. There is no magic bullet for anything.
Darn it. I wish there was. You're saying to look at trusted sources and follow common sense, but being on the internet like we are, there are a lot of people who say Harvard is an institution that can't be respected, like don't look at authority. What would you say to people like that?
I give up. I think perhaps sometimes that's a fair criticism because maybe we work in our own environment too much and we get too involved in what it is that we do. I think for us, what's important is when we have our results, again, researchers, not to take our results too seriously. We are not giving you the last answer, to look at our own data in context with other people's data. If it doesn't agree, be humble enough to say, maybe I'm wrong. I need to look at this more carefully. So I think maybe we researchers also need to do a better job of communicating, speaking in language that most people can understand and being humble about our results.
Yeah, because epidemiology, nowadays a lot of people trash that field, and it might come from a lack of just education about its basic principles.
Yeah, I think many people might not understand exactly what epidemiology is. COVID-19 was a terrible thing, but I think during COVID-19, that was the time that people sort of understood what epidemiologists did. Before then, it used to be a joke that epidemiologists would say, they'd tell people what they do, and people would say, oh, do you study skin diseases?
That's a good one.
Yeah.
So you mentioned earlier how people who do physical activity for work have less beneficial outcomes than those who do physical activity for leisure. Can you talk more about why this might be so?
It isn't really clear now, and people are looking into a couple of hypotheses have been put forward. One is the hypothesis that people who are physically active at work are people who don't control their work environment. They tend to be people who are socioeconomically more disadvantaged. Lack of control over your work environment, this could stress you out and that could lead to worse outcomes. Another hypothesis that has been put forward is the fact that people who are physically active at work is the same mechanical repetition day in, day out. You're doing it Monday through Friday. Whereas if you were doing, say, strength training, for strength training's sake during leisure, you might do it on a Monday and then not do it again until a Wednesday or Thursday. So you work, you rest, you work, you rest. But the people who are in jobs, they have to do it day in, day out because that's their job. And the idea is that the muscles do not have time to recover in between the injury. So this could be something that could lead to worse outcomes. We don't really know yet. This is one of the hypotheses that has been put out and people are looking into it.
Mm. And I know you've sat on some commissions, for example, in the US to establish physical health guidelines. Can you talk more about how your research has influenced the guideline recommendations and who knows, maybe could help influence workplace policy?
All of us do research because we want our research to be translational. We want our findings to be useful and applicable when guidelines are made. So the research that informs physical activity guidelines, the committee looking at the data, they usually look at all the data. We talked about the totality of evidence because there'll always be one errand study here or there. So we need to look at all the data, look at what all the data say, and then try to make it simple. Because imagine if you had a recommendation that said, if you are this height and weight this, you do A. If you are this height and this weight, do B. If you are something else, do C. Nobody's going to remember that. What is a challenge for people making guidelines is to have an accurate guideline that applies to most of the public. A simple guideline that people can remember.
For sports, some people argue that tennis is associated with higher longevity because people who play tennis might be more likely to be higher income. And similarly, in workplaces, people in lower wage jobs might have lower incomes and therefore they might be the ones doing more of those repetitive labor tasks. How do we separate this confounding variable?
That's a really good question, and it is a valid point. So statistically, you can adjust for people's incomes, and it doesn't completely take care of the problem, but I think it takes care of a lot of the problem. Another way of looking at it is you could study the effect of tennis playing in a group of people who are all high income. So if you look at a group of people who are all high income, you will see that those who play tennis compared to those who are not physically active, they will still have better health. And so because everybody is high income, it's not due to the income. It's due to the fact of the energy expenditure while they play tennis. And that's one of the tools we do in epidemiology. You either control for it statistically or you restrict the population so that the variable that you're worried about, in this case income, falls out of the equation. The thing about tennis and all these single sports, my previous answer about the data are not as good. To me, most of the data relate to total energy expended. The question is a valid one. Is it the physical activity rather than the fact that people who are high income have more physical activity because they have more time to be physically active? We can control for that statistically, the finding still holds. Or many of the studies that are conducted are in a restricted population. For example, if we said the women's health study, the people in the women's health study, all of them were female health professionals. So they tended to be relatively homogeneous and a higher income group. We still see the association. In the nurses' health study, again, more homogeneous, you still see the association. So it's not just the income that is explaining the difference.
So how do physical activity recommendations change in different stages of life?
That's a great question because obviously the problems that affect people, when I say problems, I mean health problems, they differ between when people are younger and when they're older, when kids are developing versus when you worry about chronic diseases. So we do have different recommendations for children and adolescents, for adults and older adults. the recommendations for children and adolescents tend to be related to increasing their fitness so that they're better body composition, they're better mental health. The ones for adults and older adults tend to focus on prevention of chronic diseases. In older adults in particular, we recognize that many of these older adults have chronic health conditions. So we do say these are the recommendations, which incidentally are the same as those for adults, but we recognize that you may have limitations. Do what you can.
Are there documented recommendations for different stages of life?
So yes, we have federal recommendations, US physical activity guidelines, and they do have them for children and adolescents, for adults, which is 18 to 64, and older adults, which is 65 and above. And we are not the only country that does it. The World Health Organization has it. Different countries all have their own recommendations, and many of them are similar to what the US has.
And is there any division between males and females in these recommendations?
There's no distinction between whether you're a man and a woman, but the conditions that are affected or benefited by physical activity are somewhat different in women. Obviously, the reproductive age, when women are pregnant or when they've just given birth. But the recommendations do not differ between men and women because the studies that we have suggest similar benefits between men and women, at least in terms of developing chronic diseases and many of the common diseases that men and women suffer from.
Gotcha. And some of these fitness influencers and whatever seem to always say that these US mandate guidelines are the bottom floor of what you should be doing in terms of physical activity. Would you say that that's not the case, that these physical activity guidelines actually represent a median that people should accomplish?
I would say, what is it that you're trying to do? Are you trying to run a faster marathon? Are you trying to lose a ton of weight? In that case, definitely the guidelines are too low. But for general health, the guidelines will give you meaningful health benefits. And in fact, it's my opinion that the guidelines probably can be lessened because remember, now we have wearables. With the wearables, we're beginning to find that even lower levels of physical activity than currently recommended will bring health benefits. Now, am I saying that everybody should just go for the minimum? No, if you're someone who can do more, go for it. But there are many people who can't even meet what's recommended now. And I think it's encouraging that the data from wearables suggests that maybe even lower levels can still gain health benefits. So do what you can, do something. And again, as you said, influencers, who say you have to do higher levels of physical activity. What do you want to do? Run a faster marathon, do a better triathlon? Yes, then you need to do more. What is your goal? Tailor what you need to do to what your goal is.
How do people know whether they're exercising too much, where they've gone over the limit?
So I think as in most things in life, there is too much exercise. Most of the US population, unfortunately, that's not their problem. We've done studies where we've shown that physical activity up to 10 times what is recommended does not result in higher death rates. But it is true, I think, that extreme athletes, for example, people who do very long ski races, people who do marathons, ultra marathons, there is the question of whether there might be harmful effects, in particular cardiac effects, cardiac arrhythmias. There's some indication that that might be so, but it's not clear. And interestingly, this seems to occur in men, not in women. So we still don't know the answer yet, but researchers are looking at it. But it's true, that's like, you can't have too much of a good thing, right? Like if you ate plants, if you ate, I don't know, a whole caravan full every day, that would also not be good.
I don't know, you haven't seen us eat, so you don't know. What was it like to try to encapsulate so much of your career in 10 minutes for a TEDx talk?
Stressful. But I also think that because I do very translatable research, I do research in steps. And this is something that people can understand. It's very intuitive. And I really want the message to get out because I think a lot of people, older people, they're afraid of being physically active. Or they don't even start because they think they can't meet the standard. I want to encourage these people because physical activity is so important for your health. If you can do this a little bit, don't be discouraged. Even if you don't reach whatever standard society tells you to, you will get health benefits. And that's important to me, that you understand that.
Let's see if I remember.